am going to talk to you all about what are the latest advances in the treatment of cancer. Hello all, I am Dr. Vishwanath, consultant medical oncologist with Apollo Hospitals, Bangalore. So conventionally over the last several decades, cancer has been mainly treated with chemotherapy, surgery and radiation. But in the last 1 decade, we have seen a plethora of new drugs and newer modalities of treatment to treat cancer. To start with a few, immunotherapy. What is immunotherapy? Immunotherapy is nothing but modulating the body's immune system to kill cancer cells. So it all started with one of the famous scientists from Japan and United States who have spent several years of basic science work and then came up with this immunotherapy. And now it has become like a blanket therapy where you give immunotherapy in most stage 4 or advanced cancers, and those patients do much better than chemotherapy or those conventional treatments which have been delivered over the last several decades. The next one is targeted therapy. What is targeted therapy? Targeted therapy is also called magic bullet. Now we have entered an era of what is called as personalized medicine. Every patient is unique and every patient has got a unique biomarker or a unique mutation which may not be common to all patients. For instance, a stage 4 patient with lung cancer, patient A, might harbor mutation which is called as EGFR. But a patient B may not harbor any of those genetic defects. So patient A may be treated with a simple oral pill which goes and specifically targets that mutation and kills cancer cells. And these patients will have least side effects and they'll have excellent quality of life and they will have very good survival. But patient B may have to be treated only with chemotherapy and will have several side effects like hair loss, oral ulcers, low white counts, so on and so forth. So this is about immunotherapy and targeted therapy. And we also have latest treatments for blood cancer. There's something called chimeric antigen receptor T-cell therapy. This is a latest treatment for certain blood cancers like childhood leukemias and adult lymphomas or cancer of the lymph nodes. So what is this CAR T-cell therapy or chimeric antigen receptor T-cell therapy? So what they do is remove the T cells from the patient's body and take it to your lab, artificially genetically engineer and make sure that the patient's tumor cells genes are genetically engineered onto these T cells, and then they push the genetically engineered T cells back into the patient's body, and that goes and targets those tumor cells, and these patients improve significantly as compared to treating them with conventional chemotherapy. So this is a remarkable advancement which has happened in the last 5 years. And then we have stem cell transplantation. In stem cell transplantation, you have newer forms of stem cell transplantation like haploidentical and so on and so forth. And then we have certain newer drugs like antibody drug conjugates and monoclonal antibodies, which have also significantly revolutionized certain treatment paradigms of breast cancer, lung cancer and other malignancies as well. Thank you.